herpes symptoms. Oral herpes is most often asymptomatic, meaning you don't exhibit any signs that you, or anyone else, carry the virus. That said, the symptoms, when present, are pretty obvious. The most common telltale symptom of HSV-1 is a cold sore. Before a cold sore, also known as a fever blister, shows up, you may experience tingling, itching, pain or burning around the mouth. This is known as a prodrome and is essentially a warning period that symptoms are imminent. Not everyone will experience a prodrome before a cold sore appears, but it is quite common. The sores can appear on your lips, around your nostrils and inside your mouth. These lesions and sores can sometimes be confused with pimples, chapped lips, bug bites and other benign conditions. The first incidence of HSV-1 symptoms is often the worst, though personal experiences vary. During this initial infection, you may also experience a fever, muscle aches, sore throat and swollen lymph nodes. Once the cold sores go away, and they may or may not make a reappearance, as the herpes virus is a lifelong infection that can lie dormant for years. Symptoms/triggers in an HSV-1 recurrence. The American Sexual Health Association estimates 1/4 of people with HSV-1 experience recurrences of their symptoms. These recurrences aren't likely to be any more severe than the first bout of symptoms, and they often decrease in frequency and severity over time. Oral herpes symptoms may resurface without an obvious cause, but there are known triggers for cold sores. These possible triggers include illness or fever, stress, fatigue, exposure to extreme weather conditions and changes in your immune function. If you're trying to avoid an outbreak, the best way to do it is by taking care of yourself, eating a proper diet, getting proper rest, etc. Causes of oral herpes. Oral herpes can be spread by kissing or any other close physical contact. The World Health Organization calls HSV-1 common and endemic and says most infections of HSV-1 occur during childhood. They estimate as many as 3.7 billion people around the world have oral herpes, including 40 to 50% of people under age 50 in the US. While it's mostly transmitted from oral to oral contact, oral herpes can be transmitted from and to the genitals. Symptomatic people are more likely to spread the virus, but it can also be spread when the skin appears normal or without symptoms. This is called viral shedding. In other words, just because someone doesn't have herpes sores on their face or genitals doesn't mean they can't pass HSV-1 or HSV-2 on to you. Oral herpes treatments. Because there is no cure for herpes, treatments for HSV-1 are generally designed to address the symptoms of the virus or the cold sores. Without treatment, the symptoms generally subside within 1 to 2 weeks. However, you can get prescription antiviral medications to reduce pain and speed resolution. Drugs with the generic names acyclovir, valacyclovir, famciclovir, and penciclovir work best if they're taken when you first experience signs a cold sore is coming and before the blisters develop. For people with frequently recurring cold sores, the medications may be taken regularly as a preventative measure called suppressive therapy. In addition to prescription antivirals, over-the-counter cold sore ointment may shorten healing time. Also, you can ease the pain and discomfort of the sore with lip balms or creams, pain-relieving ointments and cool compresses. Prevention of HSV-1 oral herpes. It's not always obvious that someone is infected with oral herpes. However, if your partner has a cold sore, it's best to avoid close physical contact including kissing and oral sex, and even sharing straws, glasses, and eating utensils. Oral herpes symptoms in women. Oral herpes symptoms. Oral herpes symptoms men. Oral herpes symptoms photo. Oral herpes symptoms throat. Oral herpes symptoms symptom. Oral herpes symptoms pictures. Oral herpes symptoms in mouth. Oral herpes symptoms primary infection. Oral herpes symptoms STD. Thank you for watching, and please subscribe to my channel for my upcoming herpes treatment videos.